Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode. In this particular episode, Dr. Ashley and I do a recap of this year's 16th annual Pat Risser RSVP conference. And let me say, just from the bat, we just appreciate everybody that participated, our speakers, all of our conference attendees, those that tabled at the event, board members. It was just another wonderful, successful event, the RSVP conference. And I think those that couldn't make the event, either in person or Zoom, will find value in the recap. And again, as we'll put in the episode description, folks will be able to watch the conference in its entirety later on this month. Thank you. Well, good morning, Dr. Ashley. How are you doing?
Good morning, boss. I'm doing great. How are you this morning?
I'm tired, Dr. Ashley.
I feel a little tired.
Yes.
Honestly.
So, audience, we have just finished up the RSVP, the 16th annual Pat Risser RSVP conference. Yeah. It was wonderful, but if you've ever been involved with planning an event, there are a lot of little details.
It's a lot, yeah.
Yeah.
A lot of work.
But it really paid off. We thought it'd be a good idea. Not everybody was able to attend in person or over Zoom. And we do plan on releasing the recording in a few weeks to the general public. We want to respect and honor those that did pay, give them first crack at it, and they can rewatch it again. But eventually, here in a few weeks, like I say, we'll post it. But it was great information, great speakers, great turnout, and we're just excited to give everybody just a kind of a recap, if you will.
Yeah.
And just talk through what happened, and hopefully it'll encourage you enough to watch the recording once we make that live on our website or on our YouTube channel.
Yeah, I think it was a great day, so I'm excited to talk about
it. Yeah, you were pretty busy. I saw you running around. You were just a flash. I really didn't have a chance to talk to you much.
I know, that's true.
There are so many details. Again, maybe to start off, when we first were talking about the conference a month or so ago, I think we did touch a little bit on the history, but I'll say just briefly, the RSVP conference is different because it's always involved consumer survivors specifically in its planning. Mm-hmm. Pat Risser and Steve Stone, originally sat down just to talk about bringing a conference to Ashland County that was different than what was typically offered, and that was more of a medical model approach is what you usually get out there, and they wanted to do something that was the opposite of that.
Yeah, I love that.
More psychosocial approaches and frameworks. So we've been deliberate over all 16 years of bringing in topics and speakers that don't espouse a medical model view, but something different, more of a holistic and, like I say, a non-medical model view. I guess sometimes that's the best way to say it.
Yeah, I think so.
So, Pat, passed away some years ago, but we've continued to have both his widow, Trish, and our Pathways Peer Recovery. They've been a core planning partner for us, and they were integral this year in bringing in a couple of the speakers. So we love that history of the conference, that nothing about us without us was something, that grew out of the consumer survivor movement. Pat was articulate in that, said it a lot. And so we've tried to always preserve that element to the speakers and to the content. Yeah,
it's really fun doing the planning of the conference with them too. We get to know them a little bit, hear their stories, and they're really helpful in shaping the conference.
Yep, I agree. So, the first speaker right out of the box was our keynote, Brooke Seam. Brooke, the keynote was Bad Medicine, antidepressant withdrawal, and the incalculable costs of medicating normal. And again, we had a teaser podcast with Brooke that folks can watch in one of our previous episodes. Brooke's book is, May Cause Side Effects, was really, I think, the foundation for her presentation. She certainly didn't talk through everything in her book, but she drew from it at points. But I think Brooke's overarching message was psychiatric drug withdrawal is a thing.
Yeah.
It's not pleasant for a lot of folks, and we don't know near enough about it as a profession to assist those that might be going through withdrawal when they make the decision to come off their medications.
Yes.
So I think she went through a series of slides and discussion with the audience about what we know, what we don't know, what we think we know. And again, and Brooke doesn't, she even has a T-shirt that says, "I'm not a doctor." She's not.
Yeah.
She's a chef by training and profession, but she is also somebody that after 15 years of being on medications to come off those, and her journey, and that's the memoir, her book. Her journey coming off, she's learned a lot, and she's wanting to give back to others that are going through a similar journey. I think her book does that. I think her talk did a wonderful job of explaining some of what happened to her, but also other people that she works with. And she did a deep dive into the literature to educate herself. I think she's talking about maybe what we think might work. She talked about this concept of hyperbolic tapering as opposed to linear tapering or going off things cold turkey, and just all the advantages, disadvantages of what we know now. But I think what the audience should know, Dr. Ashley, is it's an emerging science, if you will. We just need to raise awareness that it's a thing. First and foremost, we want folks to know that because you're on these medications, and particularly folks that are on it more than 2 or 5 years, that, abruptly stopping them, there are consequences. Our body reacts when we initially take the drugs, and it also reacts when they're withdrawn, because our bodies are wonderful in that they can adapt to almost anything. And some of these very, very strong and powerful psychiatric medications, when introduced initially, our bodies have to go through all kinds of let's just call them gymnastics, gyrations. And to adjust to what it's doing. But it gets to that homeostasis as best it can. There are usually side effects, drug effects, if you will, from the drugs initially. But for the most part, there's compensatory, is the fancy term, compensatory mechanisms in place that the body develops to deal with these new chemicals that are flooding it. But then once they're withdrawn, those compensatory mechanisms are like, what? It's like having a pedal pushed down. And then all of a sudden, it's not, the barrier that was keeping the car from going is removed, but the pedal's still down and the car shoots off. So it's just, and that takes time. That's what she said over and over again. For her, it took, over a year, but other folks maybe shorter, other people longer. So,
and I think one of the things I took from Brooke's talking and from her book, there's this information that we know, right? But a lot of people are prescribed these medicines without being informed about that. They don't know that that's a possibility. And that we don't know a lot about like taking people off of the medication.
Good point, Dr. She brought that up. If what we know now was, explained to her before she made a decision, she said, I think I probably would have made a very different decision. And that was another big point she made. So for those that are prescribers, the challenge is, are we fully explaining to folks, not in some little type 8 font sheet that nobody reads because there's thousands and thousands of words, right? That you just sign off on. But literally, they actually have a conversation about likely effects if they start one or more medications, and then the fact that if they decide to discontinue, that there's also very likely to be effects. Are those conversations happening? And if not, they need to start. And when an individual maybe has been on these medications for a period of time, they decide to come off, doctors feeling comfortable helping them in that process.
Absolutely. So. Another thing in her title she talked about is medicating normal. So she was prescribed medication at age 15 after her father passed away and she was grieving. And I think that's an important point too. Like a lot of times what we are medicating is normal. And we've talked about that on the podcast before, right? And we talk about it a lot. But I think she kind of sent the message home. So why are we prescribing medication for things that are normal human experiences? If it's uncomfortable, we want a pill for it to fix it.
Right. right? Because we tend to be uncomfortable with behaviors we can't understand, or if we're the parent, with our children that we don't understand, or maybe we're embarrassed by.
That's true. Yeah.
So, and that'll come up in the next session when we review that. But no, I appreciate you bringing up that point because Brooke said, medications really should be the last thing considered. One of the things she said, well, she was grieving the loss of her father and struggling in school. Mm-hmm. Why wasn't one of the options to maybe take a break from school, take a year off? Right. Why wasn't that an option? Why was medication something? Why was that more of an option in taking a break from school to grieve the loss and all the changes that brought to their family? Why wasn't that more of an option? So I thought that was powerful.
It makes sense to me, absolutely. Yeah.
So that was our keynote, Bad Medicine, Antidepressant Withdrawal, and the Incalculable Cost of Medicating Normal by Brooke Seam. Brooke did wonderful. So thank you, Brooke. And then the next session involved Brooke again, but this time we brought her mom on stage with her, Dee Barbish, and Dee is a counselor in her own right. But Dee and Brooke had this phenomenal conversation, a podcast on Mad America that I think we even referenced in a previous episode. And when I first heard that, this was before we even made the decision to bring them in or try to bring them in for the conference, I just really was struck by how powerful that conversation was, again, between, so here we've got the child all grown up talking to the parent about the decisions and what was going on when the parent said, yes, I'm going to medicate my child.
Yeah, that's really cool because you don't hear that perspective often.
No, and I didn't. Yeah. And that's why I was so keen to bring them both in and kind of not exactly recreate what they did on the podcast, which we'll link to, and we have before, because I would encourage our audience to listen to that when they have a chance. I didn't want them to recreate that exactly, but I did want them to do some of that for our audience, because you're exactly right, Dr. Ashley. Those conversations don't happen. I usually hear about how families have been fractured because maybe son, daughter is resentful about maybe choices that were made for them when they were a minor. And they're bearing the consequences of decisions made for them. And they have a difficult time with forgiveness and understanding of their parent. And it strains relationships. And as you know, I'm a firm believer that the stronger family relationships that we have in Ashland County and beyond Ashland County in the world, the better our society, our culture is going to be. Strong families are an essential building block. So I also saw this as an opportunity to maybe provide a vision forward for families that maybe have been fractured by this issue, that seeing Brooke and Dee, how they negotiated that, how they were able to stay strong and connected through all the years in spite of maybe some hard feelings and some disagreements. And that's just why I was so interested in bringing them in and trying to have this conversation to our audience and hopefully others who watch it.
I think that was the take home. Yeah.
Yeah. Yeah. Well, so Dee and Brooke talked about it. They specifically talked about what was going on for Dee when she, made the decision to say okay to medicating her child. And they talked about the grief. They talked about everything going on. And again, for me, I think I just posted something on this on Instagram this morning. But for me, what I call the mic drop, is that what the kids say?
Yeah.
Is that what the kids say, Dr. Ashley? The mic drop moment for me in the presentation between the two of them is when Dee basically looked at the audience and in response to Brooke asking her, well, Mom, was I better once they started me on these medications? And she looked and said to us, no, you weren't better, but I felt better. Mm-hmm. As a parent, I felt better. So ultimately, the decision helped me rather than you.
Yeah, that was powerful.
Yeah.
Yeah.
And because whether that's conscious, and I think most of the time it's unconsciously, parents make this decision to medicate the child because they don't know what to do. Maybe they're a little bit embarrassed and feel out of control by the behaviors of son, daughter. And you've got professionals more than willing to say, no, this is the right thing to do. And as Dee said, they've got an MD. They got all these fancy credentials after their name.
Yeah.
They're telling me it's the right thing to do. And once I start, things are different for my child. But the question at that point isn't so much about, is it helping them, but it's helped me. And I just thought that was honest.
Yeah, I think so.
It's not as though Dee was saying she was proud of that decision. She was just trying to explain it.
I think she's had a lot of time to process it.
Yes.
And, like, she has a lot of insight that, like you're saying, it's not usually such a conscious thing. But parents sometimes are pressured. They're hearing from the school that maybe their child's engaging in this behavior. And then the parent is pressured to take action in some way.
Yes.
And so I think she was expressing, like, I feel better because I'm doing what I'm supposed to do.
Yeah.
I'm taking some action. I'm not just not doing nothing.
Right. Because that would be seen as abuse.
Right. Yeah.
How can you, now that this is brought to your attention by schools or other folks, how can you do nothing?
But she's saying, I didn't see a positive change after you started taking that medicine.
Right.
So it was really
So why continue the daughter on it? Because it was helpful to her.
Mm-hmm.
So now, again, I don't want the audience to get the wrong impression of Dee. Dee wasn't, she wasn't saying she was right. She was just trying to explain it. And I think her point was, parent, you need to examine if that's why you're doing it. Maybe you should rethink doing it. If it ultimately isn't benefiting the child, but you get some benefit from it, that's not the calculus. That's not the way to think about the issue. Yeah. Is it truly benefiting? Someone, I think it was Dee, made reference to, if a young person is crying before they take their medications, that should matter.
Yeah.
Right? Because there are drug effects, whether you're an adult or a child. And as Dee's had to wrestle with, as Brooke pointed out in her talk, I mean, she felt like, those 15 years were almost like lost years, those years she was on those medications, because she didn't develop. She had all kinds of medical complications, some that persist to this day. Many, thank God, have been ameliorated once she discontinued, but not all. So, and again, you can't get that time back.
Yeah.
That was powerful because, as they had the discussion, Brooke said, I either made choices or didn't make choices because of the medications. Mm-hmm. And you look back at what you could have done, would have done, decisions that were made rather than other decisions. And because now that she's gotten off of them, she thinks about things entirely differently. And if she were thinking that way back then, her life would have been different. So it's hard to, you don't want to live there, but you can't help but notice it.
Yeah. Yeah. She talked about, time lost and her trajectory being different in her career and just in life in general. I think that's the incalculable cost that she's talking about. How do you quantify the time that she lost or the income that she could have made at a different job or, all of those costs too.
And a little insight here. I don't think she would mind me sharing this. I spoke a little bit with Brooke at the end of the conference, and I said something to the effect about, you must feel like you need to hurry up and do a bunch of stuff since you lost all that time. Yeah. And she pushed back and said, no, not really. It's not so much about that. It wasn't about quantity for her. She said she's very, very thoughtful about how she spends her time, all of her time.
Oh, yeah.
I thought that was really interesting. I almost wish I would have asked her that during her presentation, so that's why I'm sharing it now, Dr. Asher. But I really thought about that all night after she said that. She really considers, because of the lost time, and that means less time left, you see.
She appreciates the time she has more, maybe.
Yes. Yeah, she appreciates it, and she really thinks through, is this how I want to invest my very precious time?
Yeah.
This call, whatever it is, fun time or professional time, but anyway, that's
really interesting.
Yeah. So interesting that, again, that's a perspective that you wouldn't have unless you've gone through something maybe that she's gone through. So that was so great. So we had both of them together on stage. So I really think the audience is going to love that conversation.
I think so too. And I just want to say, working with them, they were both just sweet people, very kind and helpful in the planning of the conference. They were great to work with. So thank them both so much.
Yep, they were wonderful.
Yeah.
We had an opportunity then for folks to buy and talk to buy her book and talk to Brooke about it and get it signed. And we went into lunch, and shout out to AU here, the catering. They always do a wonderful job. Most of the folks here in Ashland County understand that, but I still always think it's nice. Erica and her staff are wonderful to work with, and so I always like to give a shout out to AU. We moved into our afternoon sessions, and Dee kicked things off talking about experiencing compassion key. And for our audience, let me just summarize briefly. I think a lot of folks know what cognitive behavioral therapy is, or they've heard of other types of therapy. I don't want to say Freud, but people have seen it in movies and television shows. But the idea of psychoanalysis, that's probably a term folks are familiar with. Well, compassion key is it's a type of working with folks that are maybe struggling, and it's newer. It does have some cognitive elements to it, but it is different, and certainly different to our county. We don't have any practitioners of this particular model type. So Dee knew that when she was coming in. So she gave us a nice overview. She only had about an hour. So she gave the audience a nice overview of what that is. And I think the crux of it for me, and Dr. Ashley, you weigh in, you're a therapist as well. Mm-hmm. As a therapist, I was really listening to it more from how is this similar or different than other approaches I've been trained in.
Yeah.
And like I said, it was the self-statements. It's not the only model that uses self-statements, but she used the self-statements differently, this idea of saying compassionate things to yourself as a way to maybe help yourself towards a goal. Does that make sense?
Yeah, right. Yeah. I thought that was good.
So that was the crux of it for me. Now, there's I don't want to get into all the techniques she used, but I think if you watch it, it's something to consider. The only thing I would have to say to the audience is there's not a lot of practitioners. The good thing about this model is it can be done online or over the phone even. In fact, it's almost preferable for a lot of people. So you might be able, if you can't find a compassion key practitioner in Ohio or somebody within driving distance, it's perfectly fine to do this via telehealth. Mm-hmm. So
yeah, one of my favorite parts about that presentation is how Dee talked about people's experiences and trauma, right? So we talk about trauma-informed care a lot. Dee emphasized, it's not about what's wrong with a person, but what happened to them, and then went through this process. It's experiential, so it's kind of like other techniques counselors use in that way. So you actually are experiencing that in the training even, which was really cool. And I could see how that would be really helpful for some people. And I've actually heard, even after the conference yesterday, people were struck by it and that it was helpful. So that was really cool.
Yeah, it really was. Yeah. I want to move on to our second afternoon. Ron Bassman, who was in Colorado, we Zoomed him in. Ron is kind of a legend in the consumer survivor movement. I'm just honored that he was willing to give us some of his time. The audience, if they watched the playback, we had a little bit of a tech snafu. It's always challenging to Zoom people in from remote locales to Ashland County. But once we got Ron on and talking, again, he shared a lot of his story, which is powerful. But also, Ron gave us a nice little history lesson of the consumer survivor movement. But he also discussed maybe how working with families individually in group in a peer way. So groups, the peer experiences. So if they had a son or a daughter that was struggling or they were struggling themselves, to utilize more of a peer model, maybe have a professional facilitate that, but that there's a lot of power in sharing those stories, successes, all of those things, getting families together rather than families being gathered together and then a model kind of imposed on them. It draws more from their experiences. It was just a slightly different take, and it comes from, I think, Ron's history, which a lot of the professional, if you will, or the established approaches weren't helpful to him. So he really is intentionally tried to develop alternatives for folks individually or collectively as families that would be, in his mind, more helpful.
Yeah, it's differently informed than other approaches because he has that experience. He's a professional in mental health, but he's also had, he was a patient in a mental hospital. Like, he has that experience also. And he emphasizes the importance of family in the process of recovering.
Yep.
And I love that.
Yep.
So.
Absolutely.
Yeah.
Last but not least was our friend Stanley Frankert. Stanley is a robust, powerful speaker.
He's a fun speaker.
He is, and we put him last intentionally because just in case, Dr. Ashley, any of the attendees were getting a little tired, we needed somebody to perk them up, and Stanley was the perfect fit. And
Yes.
Stanley does trainings here in Ohio around the peer support model. So his talk was peer support and an evidence-based look into the importance of peer support. And so he talked about, the training, what it means to be a peer supporter in Ohio. He talked about the training and the ongoing education that's required. He talked a lot about how being a peer supporter is similar and different to maybe some of the other disciplines like counselors and social workers.
Yeah. I loved in his talk, he shared a little of his history too.
Yes. Yeah.
So he was, I think he said he had a life sentence. He was in prison and then got out, and he had a heck of a time finding a job. He talked about that, and then found a passion for peer support and peer recovery. That's why he's doing what he's doing now. And I loved hearing that. So again, another consumer, and he's sharing and sharing his learnings from his experiences.
Right, and that's the key for the peer support or the peer supporter is, in an appropriate way, they leverage or utilize their own recovery story to help others. And as Stanley said, because of his unique history with criminal justice system, that's kind of where he works best, with other folks that have had a similar history to his. Mm-hmm. So whether that's somebody maybe transitioning out of jail or a prison, or struggling in recovery, maybe in a recovery house or something like that. So somebody that's struggling to get employment, he talked about how hard it was for him with the felony conviction to find employment. And I can only imagine, him sitting down saying, listen, I had 700 applications, rejected until I got somebody that was, helping somebody be patient, explain, you're not the only one, maybe helping people find friendly employers. I mean, so not only can he use his personal experience in his recovery journey, but then he can also, I think, share successes, what he's learned.
Absolutely.
To help others.
It was a hopeful message.
Yes.
It was a message of
Well,
hope.
now, Stanley would smile if he heard you say that,
I know
Dr.
he
Ashley,
would. That's why I put it in there.
Hope was a big theme in Stanley's presentation, and I really enjoyed meeting Stanley in person.
Me
and
too.
I would say, if you're looking for a speaker at an event, all of our speakers are wonderful. I would consider getting a hold of Dr. Ashley or I. We can put you in touch with any of our speakers, and Stanley is a wonderful one if you're looking for somebody with a lot of high energy and passionate. I am drawn, whether it was Brooke or Dee, Ron, all of our speakers, they have passion for what they're doing. Yeah. And I've found, Dr. Ashley, over the years of doing these events and trainings, not just RSVP, all we do, you can't substitute for passion.
Right.
So our speakers tend to be extremely passionate about what they're doing. Whether people agree or not, they can't say that they don't really care about what they're doing, and that matters to me.
Yes, we can't thank them enough. I mean, this year's speakers were amazing. So just want to say thank you.
Well, thank you for taking time to recap it. I know you're ready for a nap. That's fine. You've earned it, Dr. Ashley. The conference was a success. I thank all the folks that came, either in person or Zoom. We really appreciate the community support, the support of the Mental Health and Recovery Board, our contract partners, Appleseed, Acada, and Catholic Charities. Thank you. And until next time, Dr. Ashley, let's keep Ashland healthy.
Yes.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.